Good afternoon to everyone and welcome to today's class. We welcome our online students Dr. Manu, Kirti, Bhavangiri, Tirupati and many other students in Guntur, Vizag, etc. etc. So I hope you enjoyed navigating through 240 questions. Have you? Could you reach the end? No, you could not reach the end point till 240. So, still, November is prospectively assuming that it is the next NEET PG. From now onwards, we have nearly around 40 Sundays, 30 to 40 Sundays available. So every Sunday we keep solving, make a habit of solving a full-scale paper and then discuss questions and score ourselves and then recharge to participate once more from Monday to Saturday in our regular evening session of review. So that is how the next 30 weeks must strengthen us to face any entrance exam. So let us make the great beginning. Clavicular dislocation at the acromioclavicular joint. What prevents? Very good. Tara and Manu are proposing acromioclavicular ligament. Absolutely right. So typically this is the clavicle, this is the acromion, and what you have is coracoclavicular and acromioclavicular joint. Ligament. Out of this coracoacromial ligament is the one which is mainly responsible for preventing the acromioclavicular dislocation. Now, a 54-year-old female, chronic pelvic pain, right-sided ovarian mass. So how will ovaries, blood vessels will be passing, and which one do you want to ligate in order to prevent excessive bleeding? What is your answer, doctor? You like to propose? Transverse cervical ligament is a proposal coming from Femida. What's your name, doctor? Fatima and Jiaul Haq are among our online, classroom audience here. So that is the proposal. Let us see. Bandaru, Priya, Kirti, Tirupati, they are all proposing ovarian ligament. So we should remember, doctor, the nerves and the vessels supplying the ovary are delivered to the suspensory ligament of the ovary is what need to be remembered. And the ovarian blood flow is basically through ovarian arteries which arise from the abdominal aorta. Transverse cervical ligament, as proposed by Fatima, is actually cardinal ligament. It extends between the cervix and the lateral fornix of the vagina, and basically the uterine artery courses through this cardinal ligament. Hence, if you are doing a radical hysterectomy, then cervical ligament need to be basically that is what need to be remembered. All sensory pathways invariably have to reach thalamus. It is their first station. Thalamus is the sensory relay station. From there to sensory cortex, all the relay will occur. So, without touching thalamus, which sensation will pass? Question number 3. A good number of people are proposing, Kirti, Priya, Tirupati are proposing D. But Tara Chand is intelligent. He is proposing smell. What is your answer, Joel? Smell only, right? Very good. Manu thought it as pain. Pain definitely will pass through thalamus. Thalamus is also called bedroom. All sensory secrets will reach the thalamus. So that's the reason thalamus is also called bedroom, not the smell, is what need to be remembered. Now, I leave all this in the literature given to you. Okay. A 21-year-old who is a football player, 12th rib got fractured on the left side, not on the right side. Then, which is the structure most likely to be lacerated? As shown by the answer already, the left kidney lies immediately deep to the tip of the 12th rib on the left. Hence, it is the one which is typically injured. Left gastro-omental artery. It typically arises from which artery, doctor? Which vessel will give rise to left gastro-omental artery? Give me some guesswork. Gastroduodenal is Zia-ul-Haq's proposal. Question number 5. What our classmates are saying. Tirupati is proposing splenic. Tarachand also is splenic. Priya is supporting your gastroduodenal, but it is the splenic is what need to be remembered. Yeah. So you can see here, there is a splenic artery from which the gastro-omental artery will be typically arising from at the greater curvature, and it will ultimately go and anastomose with the right gastroduodenal artery. Now, a patient is having a problem in abdomen, but final idea is there is some leakage occurring through the intestinal lumen. Which subcellular structure is responsible for preventing such a kind of a leakage is one of the important issues. What is your proposal, doctor? Tirupati, Tarachand are bidding their bet on Jonule occludens, which is in fact correct. Just a moment, I'll just correct this. Transitions are timed. How can you save this? Apply to all. Okay. Yeah. Okay. A thyroidectomy had been done, and you found that there is a nerve which is entering at the junction of the inferior constrictor of the esophagus. Now, if there is any lesion to that nerve, then what is the important function that get affected? Doctor साहब को question paper दे दो. What is your proposal? See, you like to say why? Because which nerve are we talking about? Inferior laryngeal nerve innervates all the muscles of the larynx except the cricothyroid. Now, in both the sexes, where will the inguinal canal is typically formed, doctor? What is the source of inguinal canal? Give me some confident answer. Patent dash will give rise to indirect inguinal hernia. Processus vaginalis. Very good. Inguinal canal is typically formed from processus vaginalis. Now your patient comes to the office with a complaint and his face looks very funny. You discovered geniculate ganglion is problematic. So what is geniculate ganglion basically? It is an important relay station for which important group of nerves? What is your possible answer? B. Postganglionic parasympathetic neurons and sublingual gland is a proposal coming from Fatima. Tara is proposing C. Priya is proposing A. And Tulasi is supporting A. Typically, what does ganglion, the geniculate ganglion, doctor? It contains the cell bodies of the neurons that ultimately innervate the skin which is covering the mastoid, because it is the one from where posterior auricular nerve will be arising, is what need to be remembered. Now, within the liver, the blood within the sinusoids will ultimately drain where? Which will in turn will be draining into into IBC. So, what is your answer? Where will it drain into? The blood in the sinus. Everyone is proposing central vein, including Priya, Kirti, Tirupati, Tara. That's right. The liver sinusoids typically will be draining into the central vein. Now you have a Bowman's capsule. The urine typically will be passing from the Bowman space into which of these structures? Cheapest question. Our biology teacher in 8th class taught us. Right? Oh, still? Right. Parachan correctly said proximal convoluted tubule. We will incorporate more difficult questions in the kidney physiology in future. A patient suffers from pituitary disorder because of a decrease of the ACTH production. So, John of fasciculator, what does it basically produce? You have different zones, right? So, zone of fasciculator of the adrenal gland typically produces what? Who gives me confident answer? So, Tara, Priya, everyone is proposing only cortisol. Is it only cortisol? You like to say? Mandela also? All of them? Very good. Glucocorticoids, including cortisol and the other substances. Now, for ovulation induction, what is very important? Pre-ovulatory surge will occur in which important hormone? Yes, doctor? FSH or LH? Question number 13, very good. It is a luteinizing hormone surge 48 hours before will be the one which will be responsible for stimulating the ovulation. Now, this is an interesting question. Which of these cells in the RBC cell line production doesn't contain a nucleus, hence it is incapable of dividing? In the erythrocytic series, which would not provide proliferative cells. If the nucleus is there, a cell can proliferate. So when will it can't be able to proliferate? Interesting question. Priya, Tara, Tirupati, Manu, they are all in favor of basophilic erythroblast, but that is not correct. So it is a uniformly wrongly thought answer. So doctor, the only nucleated cell in the erythrocytic series which is not mitotic. It is nucleated but not mitotic. Sorry, I said it is non-nucleated. No, but it is nucleated but not mitotic. Orthochromatophilic erythroblast. And it contains a compact nucleus which later on become extruded. There is an inability to tense the soft pellet at the time of swallowing. Very interesting question. If you answered this correctly, I can say you are super duper D distinction in anatomy, at least in neuroanatomy. Probably which cranial nerve is important? If you recognize that, then you can be able to answer what are the other functions of that cranial nerve. Question number 15. Very good. Tirupati and Priya are saying weakness in the ability to elevate the pharynx during swallowing because they are thinking about glossopharyngeal, right? Generally, it's a reasonably correct guess. When I have seen nasal regurgitation, immediately I too thought the same. But ability to tense the soft palate. I am giving you one more clue. Manu is proposing B, altered taste sensation, because he is thinking of which nerve? Probably vagus. No, glossopharyngeal only. Yeah. So D is correct. You thought D? No. D who thought? Tarachand has thought D. Very good. One big clap to Tarachand. So tensor velipelatini is innervated by medial pterygoid nerve, which is a branch of the mandibular division of the trigeminal nerve. And it is the only muscle in the palate which is not innervated by the vagus. Generally, palatal muscles are all innervated by the vagus. Right? So Tarachand gets a distinction in anatomy. Very good. So when we do mistake, when we debate about that mistake in a Sunday test, that remains as a memory. Tomorrow's entrance when you take. So that's the purpose. Every Sunday, whatever be the preparation, come down for the discussion. And even if you don't take paper because you may have morning injection rounds in the hospital as a house surgeon, still come to the discussion. So we can debate, extempore, try some questions. No doubt that. What forms a choroid plexus? Choroid plexus is basically formed by what? You like to say? Paya and the ependyma is Tulasi's proposal. Excellent. Tirupati Tarachand is also saying Paya and ependyma, which is correct. It is the extension of the paya mater and choroid vessels into the ependyma. The dura mater and the arachnoid are not the components of the choroid plexus. How did you get this Gyan, Tulasi? Purva Janma Gyan. Very good guess. Very good. Now, low pressure vesicles that contain pinocytic vesicles in the cytoplasm of the endothelial cells, what are they typically called as? Subtype of what? See, there are two types of questions in entrance, you know. One are standard, predictable, previous. Other are innovative, newly created questions of the examiner's taste. But both of them are based on high yield topics only. Remember, the second type require your guesswork, because at your spinal cord level you are not ready to answer. If it is a old question, without using brain cells only you can answer. So let us practice for a few Sundays to expand the horizons of our guesswork with new questions. That's my idea. After that, before entrance, we will have more standard, old, predictable questions. Question number 17. Excellent. Tirupati, Tarachand are proposing continuous capillaries. So you must know where are each type of this. Continuous capillaries are the low pressure vessels where the endothelial cells are joined by tight junctions, is what need to be remembered, and typically you have it in certain locations where the tightness is needed. Now regarding to gallbladder, what is the nerve supply, blood supply, and type of epithelium, everything on gallbladder we have to be 100% sure. Question number 18, who will give me the correct answer? Tirupati proposes C. Peritoneum only surrounds fundus, body and neck, in their opinion is wrong. Even Priya, Manu, Tara are accepting that. Excellent. Fundus is the only part of the gallbladder completely surrounded by the peritoneum, is what need to be remembered. This is a very standard question. Any posterior ulcer in the posterior wall of the stomach? Typically, which vessel? Which structure in the stomach bed? Structures in the stomach bed is one of the standard question in the anatomy, right? So, I am elated. Our Guntur students are also answering the questions. Excellent, doctor. Excellent. You are making, you are adding extra energy to the teacher. So, question number 19. What is your answer? B versus D. B you like to propose? Excellent, doctor. So, splenic artery. Now, around the shoulder joint, you have all these collaterals except what? Question number 20. So, anastomosis around the femoral neck, anastomosis around the shoulder, these are all some of the important topics of the examiner. So, Tirupati, Mannu, Tara, everyone is proposing lateral thoracic artery is except. What is your proposal? First point your answer. Superb. So, subscapular, superficial, cervical, suprascapular, they are the typical anastomosis that will be forming around the shoulder. What kind of gland is a sebaceous? Holocrine, apocrine, ecrine, paracrine. In JIPMER entrance, any paper you take in JIPMER question bank, any year, one question will be there on apocrine, holocrine, ecrine. The histology department is very, this favorite question of the, so sometimes some questions will be appearing in a particular entrance because that particular examiner's favorite. 21. Tirupati is giving 3 B's. Guntur is proposing A. What do you say? A? Oh, it is the holocrine, doctor. Priya, Mannu get a big clap. So, apocrine sweat gland secretion is odorless and they are found in the dermis and subcutaneous fat of the breast areolae, axillae and genital area. And apocrine secretions are also odorless, but skin commensals can make them develop odor. Holocrine are ones which are associated with the sebaceous genitals that discharge entire secretory cells to release the secretory products. So that's the nature of the holocrine glands. Ecrine are present most of the skin on the body except in the areas like lips and glands. Ecrine is missing. And how to recognize ecrine, otherwise called mirocrine? They secrete a watery fluid which is very rich in sodium and chloride, sweat directly to the skin surface. Now, okay, a 34-year-old is having tingling sensation, means hypocalcemia. So that is the reason calcium chelation is possible, and hypocalcemia is one of the complications of a blood transfusion. So all complications, hypothermia, hypocalcemia, blood transfusion complications is a hot topic. Now doctor, during strenuous exercise, coronary blood flow to the normal heart increases. So what are the major limiting factor for the coronary blood flow from increasing whenever there is an increased demand? What is your proposal? Fatima is having some answer ready. D, you like to propose duration of diastole. Excellent. So any high heart rate, for example, will decrease the diastolic duration. Any decreased diastolic duration will jeopardize the blood flow to the coronaries. So that is the reason a high heart rate need to be avoided whenever the coronary results to the heart are very limited, due to 2 reasons. One reason, because of increased myocardial oxygen demand due to tachycardia. Second, decreased diastolic filling time will decrease the coronary circulation is what need to be fundamentally understood. Okay, doc. Many drugs and toxins, they inhibit the substance flow across the membrane. So which one inhibit the primary active transport? A little sneezy question. Yeah. 24. Everyone, Tirupati, Tara, Priya are all proposing omeprazole, classical example of a proton pump inhibitor. Proton pump is involved in the active transport is what need to be remembered. Now, to confirm the menopause, high levels of which substance you will confirm? Menopause means low estrogen is there, high gonadotropins are there. But which one will you depend on in order to confirm the menopause? Question number 25. Tarachan, Priya, Manu, Tirupati. Oh, Tirupati is proposing estrone. Everyone is saying FSH. What is your answer? You are in favor of? Estrogen? FSH. Elevated FSH confirms the menopause. And LH can also elevate, but not that much as FSH. So hence FSH is better. Now doctor, which receptor mediates the secretion of the epinephrine by the adrenal medulla? Autonomic physiology, autonomic pharmacology. My favorite areas. Even today, I love to go to the reading room and read like a student, first year student. As such, I don't know anything about it. That gives a joy. So there is a bigger joy in teaching that also to wonderful students like you. So, doctor, 26. B versus D. I know. Priya is also proposing A. Our LKG teacher teaches us ABCD. But a good teacher in medical college taught us alpha B, beta. अगर वो अल्फा बीटा में कुछ फर्क हो गया तो entire medical college, our concepts are all beaten up. So we need to be very sure. So doctor, preganglionic sympathetic fibers, who said D? Let me check. D was answered by Tara Chand alone. Question number 26 ko. He gets the gold medal. So, preganglionic sympathetic fibers synapse on the chromaffin cells of the adrenal medulla at a nicotinic receptor. And epinephrine is released into the circulation. Now, cutting which structure on the right side will cause blindness of the left temporal field of the, the temporal field of the left eye and the nasal field of the right eye. We discussed it, no? Already in visual abnormalities in ophthalmology. Question number 27. Tarachan, Kirti, Priya, Guntur. They are all proposing optic tract. Excellent. So how about the temporal fibers, nasal fibers, which will decussate? How is the alignment? We have discussed already in our ophthalmology class. This is an interesting question. A balance dancer, Kathak dancer, is spinning to the left, and her eyes are also spinning to the left. So this fast eye movement is what basically? She is spinning to the left, and the eyes are spinning with a fast component also towards the left. Is it nystagmus or post-rotatory nystagmus? So a Kathak dancer spins and stops. So at the time of spinning, the nystagmus which comes is basically called the nystagmus. So it occurs in the same direction as the rotation. After the spin is over, when you stop, once more the ice will rotate in opposite direction, which is called post-rotatory nystagmus, where the fast component is towards the opposite direction. Excellent. CSF, if you take, which ion is in a low concentration in CSF? Question number 29. So CSF, there are too many things in our entire this thing to remember. Perilymph versus endolymph. CSF versus blood. What else is there? Aqueous humor in posterior chamber versus anterior chamber. And constituents of the vitreous humor. Too many fluids in our body, but their ionic composition is a favorite issue for the examiner. Everyone is answering protein, is it? So, excellent. CSF is very similar to the constitution of interstitial fluid, and it is similar to ultrafiltrate of plasma, but it has got a very low protein content. Which drug will stimulate, adenylate, cyclase out of all this, doctor? And cyclic AMP, yeah? Norepinephrine, excellent. So, only beta 1, beta 2 adrenergic agonists stimulate the adenylate cyclase. Norepinephrine is a beta 1 agonist. Atropine is a muscarinic cholinergic antagonist. Clonidine is a alpha 2 adrenergic agonist. And phentolamine is a alpha 1 adrenergic antagonist. And phenylephrine is a alpha 1 adrenergic agonist. Oh, these basics must be well ingrained into the mind, not only for entrance. Even tomorrow as a clinician, all your therapeutics are based on, if you are a cardiologist or whether you are an obstetrician controlling a postpartum hemorrhage or hypertension or pregnancy, all your therapeutics are based on autonomic nervous system pharmacology. How will an inhibitory postsynaptic potential is created, doctor? Fundamentally, it hyperpolarizes the chloride by opening the chloride channel is what need to be remembered. Let's go a little fast for a few questions and then we will slow down. Now, which receptor is activated by low concentration of the epinephrine released by the adrenal medulla and leads to vasodilation? This I want to leave for a quiz. What is your answer? You like to say beta 1? Beta 2? Beta 2 is the answer of Fatima. Tulasi, what is your proposal? Beta 2? Beta 2? Oh, Tirupati, Guntur, Tarachand. Everyone is beta 2. Oh, you're all excellent already in autonomic nervous system pharmacology. Very good. Beta 2 receptors lead to vasodilation. Alpha receptors produce vasoconstriction. But beta 2 are much more sensitive to epinephrine in low concentration. So at low doses, epinephrine acts on the beta 2 and lead to smooth muscle relaxation leading to vasodilation. But in high concentrations, epinephrine will go and act on the alpha receptors and lead to vasoconstriction instead of dilatation is what you have to basically remember. Excellent, doctor. Oh, this is another important area which you need to be very sure. What are nuclear bag fibers, nuclear chain fibers? We are going to fully spend one wonderful evening 5 to 8 p.m. when we discuss physiology to master this topic on the monosynaptic, polysynaptic reflexes, etc. But for now, nuclear bag fibers are a type of intrafusal fibers. The other type is basically nuclear chain. So, these are typically located in muscle spindle. The dynamic changes in the muscle length are basically detected by them, and they in turn will be giving rise to nuclear bag fibers to the 1A group of afferents that are innervated by the gamma motor neurons. And the other type is intrafusal, which is nuclear chain, and it detects the static changes in the muscle length, is what I want to underscore. What do you have in the apex of the lung? Ventilation is more in the base than apex. Perfusion is more in the base than the apex. Both of them are more in the base. But V by Q ratio is more in the apex than base. Why? When you go from apex to base, ventilation increases towards base, perfusion also increases towards the base, but the increase in the ventilation is more than the increase in the perfusion. So V by Q is what? Ratio, no? So numerator क्या है? Ventilation, right? Sorry, when you go down, both ventilation, perfusion increase, but perfusion increases more than ventilation. So that is the reason perfusion is in denominator. If it is increased more, the ratio will become lesser. Hence base will have lesser V by Q, apex will have higher V by Q. Anywhere where there is a higher V by Q, there is a better ventilation. It means, better exchange of gases. Hence what will happen in apex? Typically, apex will have better V by Q ratio, not the base. Option C is ruled out. It is not the same V by Q ratio. Apex will have better ventilation, base have poorer gas exchange. Hence, because the poorer gas exchange, if you look at the capillary PCO2 value, it will be higher in the base than in the apex. Okay, summarize, doctor. Ventilation will be more in the base, perfusion is more in the base, but increase in the perfusion is more than the increase in the ventilation in the base. Hence V by Q ratio as a ratio is lower in the base, higher in the apex, and in the apex there is a better gas exchange. Hence PCO2 levels will be lower in the capillaries because of better exchange than in the base. Okay, now question number 35. A woman runs a marathon, drinks a lot of water without salt. So what's happening in her? She has a net loss of NaCl without that much loss in water, and hence there is a decreased plasma osmolarity in her. So in the CNS, it is the GABA which is considered to be inhibitory neurotransmitter. Inability to perform alternative movements, dysgeucokinase A is basically cerebellum. Even LKG child will be knowing it. Now, increased contractility in Frank stalling, what will it do? Any increased contractility will increase the cardiac output and drains the blood out of the heart, and hence it will cause, for a given end-diastolic volume, higher amount of cardiac output. If a heart has a lesser contractility for the same given end-diastolic volume is whatever that heart got filled at the end of the diastole. So more contractility means for the same end-diastolic volume there will be higher cardiac output. Then sympathetic nervous system is a more bigger controller than the local metabolites. For the blood flow to which organ is a important question. Who will give me the correct answer? Question number 39. Tulasi, what is your answer? You like to say? Brain? Skin? Skin? Right? Mannu is also skin, Tara skin, but Kirti is proposing heart. So, it is to the skin, it is not the local metabolites like adenosine which will increase the blood flow, but rather it is the sympathetic nervous system. Now, water deprived person from SIADH, beautiful question. Whoever answers this, we will give a DM endocrinology seat. Come on, quick, DM seats are going cheap. Who will give the correct answer? So, primary polydipsia versus SIADH versus diabetes insipidus versus water deprivation. these 4 conditions, urine osmolality kaisa rahega, plasma osmolality kaisa rahega. You have to be 100% sure. Very simple. Tirupati, Guntur, Kirti, everyone is in a mood for saying plasma osmolarity. Is it? What is your proposal? Simple doctor, water deprived. अगर पानी नहीं पिए तो क्या होता? ADH का प्रोडक्शन होता. और ADH का प्रोडक्शन होने की वजह से क्या होता? Urine become high osmolarity. Urine become high osmolarity, but plasma is in a water deprived person also has high osmolarity, which is a stimulant for ADH release. But when do you call inappropriate ADH? Even when the plasma osmolarity low, still ADH is produced. Unko bolte hai inappropriate ADH release. But whatever be the reason, when ADH is released, it will cause water retention and makes urine become hyperosmolar. So both water deprivation and ADH, dono mein urine osmolarity will be high. But water deprivation mein plasma osmolarity will be high, which is stimulating ADH. But SADH mein normal or low plasma osmolarity. In fact, low plasma osmolarity होने के बाद भी ADH produce हो रहे. इसको बोलते हैं inappropriate. Hence, a low plasma osmolarity is equal to SADH. High plasma osmolarity is equal to water deprivation. But both of them will have high urinary osmolarity. Is what you have to basically remember. Now, doctor, nicotinamide के लिए tryptophan चाहिए. 5-hydroxytryptamine is niacin, from niacin nicotinamide, nicotinamide से NAD. Easy question. Then 34-year-old is having hyperglycemia with gestational diabetes. Now, which genetic condition, which enzymatic problem can lead to development of a predisposition to glucose intolerance and hyperglycemia? Question number 42. Tirupati is proposing glucokinase. Excellent. Glucokinase deficiency is a glucose sensor in the pancreatic beta cells. Any inactivated mutation of this particular glucokinase will lead to development of hyperglycemia. A 56-year-old has increased fatigability, exertional dyspnea with a high output failure. Thiamine deficiency associated beriberi is what need to be remembered. Then impaired ability to oxidize the long chain fatty acids and phytanic acid. Basically, we have two things: beta oxidation, alpha oxidation. Beta oxidation ka end product is acetyl CoA. Alpha oxidation ka end product will be like phytanic acid. It is the peroxisomes in which this alpha oxidation is basically carried out. Now, codon. This question you should answer. Initiation codon is AUG, AUG. 45. Very good. Tara, Guntur, everyone is proposing AUG, which is correct. UAA, UGA, UAG, they are all basically called stop codons. Now, in E. coli, how will be replication can be so rampant and so fast? Hundreds of replication folks will be working simultaneously on each piece of the chromosomal DNA, making the replication become very, very fast and create a giant chromosome. So what is the promoter site on a DNA? It is the one which initiates the transcription, is basically called as the promoter site. So how will transcription will begin? When the RNA polymerase goes and binds with the promoter, then the transcription will be typically beginning. Now, out of all this, it is the ligand binding domains to which the regulatory factors will be going and binding intracellularly is what need to be understood. Now, what is the main substrate for gluconeogenesis? Give me one confident answer, doctor. Open for the quiz. Question number 49. Huh? Excellent. What is your answer? Jiaul had thought it as glycogen. You thought, very reasonable guess. Primary substrate. Question number 49. Mannu, Guntur, Kirti, Tirupati. Everyone thought it as B, which is correct. Glycogen is the most commonly thought answer, but not the truth. So glycerol, lactate, propionate, and certain amino acids like alanine, they are all the primary substrates for gluconeogenesis. Glycogen is a storage product fundamentally, and 2,4-dinitrothenol. How does it basically act like a uncoupler is my question to you, all of you. So inhibitors of the electron transport chain, doctor, एक बट्टी मारने का टॉपिक है. You have to agree with that part of the nasty by-hearting part of every subject, not only biochemistry. So doctor, it allows the electron transfer in the presence of oligomycin. Oligomycin blocks oxidation phosphorylation by acting on the phosphorylation, whereas uncouplers are the antipathics, which increase the permeability of the inner mitochondrial membrane and reduce the electrochemical gradient, and that's how they inhibit the ATP synthase, is what you need to remember. Now, what is xeroderma pigmentosum? Nucleotide excision repair. No big challenge in this question. Now, if you look at the replication fork, it basically has got 4 components. Which one is responsible for producing the short RNA molecules needed for the DNA replication, doctor? Classically, it is called primase. The job of the primase is to produce those short RNA molecules. Now, eukaryote versus prokaryote, इन दोनों में ट्रांसक्रिप्शन में क्या फर्क है? Basically, if you look at prokaryotes, both transcription translation takes place in cytoplasm, and in eukaryotes they are specially separated. Transcription takes place in nucleus, translation in cytoplasm. Only eukaryotes have got 3 types of RNAs. RNA polymerase 2, it is a major form of polymerase mainly responsible for mRNA production. Polymerase 3 is mainly responsible for the synthesis of rRNA and tRNA. So when we take up biochemistry, we will nicely give 2 to 3 days for a complete review on DNA, RNA, genetics, everything, so that in exam, when we go to exam, there is no more hollow in our mind. That should be the idea. Now, what type of mutation where sickle cell anemia is being produced is basically called as? It's an example of a missense mutation, because of which a hemoglobin is produced, but it is senselessly sticky. That makes it a sickle cell. Now, this is a question which you need to review the literature. I mean, explanation given to you. Very simple. 2 normal genes, 1 abnormal gene. But that abnormal gene binds with 1 normal gene. So 50% is bad. But the other normal gene binds with the 3rd normal gene. So that 50% is normal. So that is how few addition subtraction problem of 2nd class, 3rd class children. Now, oligomycin, how does it basically act, doctor? It inhibits the mitochondrial ATPase. That's what we have discussed earlier. What is isoelectric point? That is the point where the charge of the protein is absolutely zero and Zwitter ion formation is what you typically come across. Now, which amino acid is a very recurring amino acid whose alteration can typically lead to distortion of the collagen molecules? Glycine छोटा होता है, glycine frequently होता है. अगर glycine छोटों को कुछ हो गया तो पूरा molecule get disturbed. So that is very, very important. So glycine is the one which need to be remembered. So which is the one which is a positively charged side chain, doctor, out of all this? Give me some confident answer. Positively charged side chain. Amino acids are a little puzzling, quizzing kind of questions in amino acids. Some guesswork. 59. Guntur is proposing arginine. Very confident in biochemistry. Superb. Arginine. Guntur gets a big clap. Both arginine and lysine are the ones which have a positively charged side chains is what you need to remember. Then it is the affinity chromatography which enable the purification of the proteins which is based on some specific property of a particular given protein. Now, microbiology. So, post-auricular tenderness and a skin rash classically are seen in the case of the German measles, rubella, and so to which class rubella belongs to is what you have to be very clear to answer this question. Now, a 14-year-old male, purpuric lesions, hemorrhagic destruction of adrenals. So what does it mean? Waterhouse-Friderichsen syndrome. So it is typically caused by the Neisseria meningitidis, and that's the reason meningitis is what is basically suspected. Very good. Now, H influenza का immunization देने के बाद भी H influenza आ गया. क्यों आ गया? किस्मत. So, अगर नसीब और किस्मत में नहीं है तो नहीं मिलेगा, is the दादाजी की कहावत. So I used to ask, वो तो सही बात है, मगर मेहनत का रोल भी होता ना, खाली किस्मत के ऊपर डिपेंड करे तो क्या फायदा? Then दादाजी's very skeptic answer is, वो मेहनत करने के लिए तैयारी मन को लगना भी किस्मत में होना है. So किस्मत all begins with your preparedness to first do hard work. Hard work may lead to good results, okay, but you need to know, you need to get a mood to do hard work. That is also kismat. Oh my God. So don't depend on kismatology. So very good. So a non-capsulated strain of H influenza, if it is leading to infection, then even if you received a capsulated vaccine, कोई फायदा नहीं है. Now doctor, neutrophil oxidase problem is there, chronic granulomatous disease. So there is a genetic defect in the NADPH oxidase. It's very important for the killing of the microbes using a neutrophil phagolysosomes. So which infections are very common in them, doctor? Staph, Pseudomonas, Serratia, Nocardia, Aspergillus. Then Streptococci are catalase negative. Chronic granulomatous patients are only predisposed to catalase positive organisms like Staphylococci is what you have to basically carry home. What is the main secret of bringing down the neonatal tetanus, doctor? It is the vaccination of the young adults who are in a reproductive age group. so that the immunization of the mother will be able to pass passively across the placenta, IgG, and can prevent the development of the neonatal tetanus. Now, a 12-year-old is receiving nepenicillin. Very little response after 2 days of therapy. The gram-positive cocci in clusters are developing. What is the cause of this treatment failure? So, methicillin-resistant strains of Staph aureus, they are resistant to all the beta-lactams. So, what is the mechanism of the bacterial resistance, drug resistance? It is the altered penicillin binding protein which is the underlying cause for the development of the methicillin resistance is what we need to basically appreciate. Then let us talk about Neisseria. How do you like to describe Neisseria, doctor? As a part of the normal flora, Neisseria are the ones which provide the natural immunity and the local host defense is what you need to basically appreciate, because we have a lot of non-pathogenic Neisseria which are living as a normal commensals and helping as fever doctors, preventing the development of infections. Now, a survey of 100 healthy adults is showing 80% toxoplasma positive. So, how will you explain this? Toxoplasma is worldwide widely spread, but most of the times toxoplasma in an immunocompetent person, infection is mild and it is very self-limiting in nature is what you have to basically remember. Then if you look at the CMV infection, how do you like to describe it? Typically CMV is capable of transmitting across the placental barrier, but once more, if immunocompetent the host, then the CMV infection also is very, very limited. Now, rotavirus, what is a very important property of it? ELISA of the stool is a wonderful way by which you can be able to detect the presence of this very common cause of the infantile diarrhea, rotavirus. Now, growth is not detectable in the Lakh phase. Between the entrance exam and the results we don't study, no. So, that is called Lakh phase. Because we are quite either, we are too sure that we will get the seat or we are very sure we don't get the seat. So, until results come, we don't open the books. Then, stool has a oval organism which is acid fast. How do you basically identify this in a retroviral patient? It is a classical description of the cyclospora, and DNA can be transmitted by in a soluble form from the donor to the host. What is this mechanism basically called as? This is an example of transformation, conjugation, transformation, transduction, bacteriophages, etc. Now, there is a green pus which is noted in the burnt tissue. Now, what is the way, how do you like to describe this? Antibiotic resistant clinically relevant bacteria leading to the wound infections. We need to strongly think of the presence of pseudomonads, which are gram-negative, motile, aerobic rods that produce the water-soluble ligaments, pigments, like which are blue and green is what need to be remembered. How would you like to describe mucor? Mucormycosis is a very important infection in the diabetics, which carries high mortality. So, mucor is a single-tipped sporangiophore with no rhizoids or stolones, with non-septate hyphae, which show the branching. Now, this mycology is perplexing good number of times, but we need to know the morphology of the conidiophores, which are branching, which are dimorphic, all those things we will rattle it in our micro discussion. So, doctor, 45-year-old with a swelling of multiple joints, early morning stiffness. What is your diagnosis? Rheumatoid arthritis. Hence, we basically give prednisolone, which is a wonderful drug. A new drug is blocking the cell wall of the fungi, ergosterol. So what is your likely possibility? It is going to be more fungostatic because it is not attacking the nucleus. So it can be fungicidal. So which group of drugs belong to this property? Ketoconazole, fluconazole, itraconazole, voriconazole, they are all fungistatic because they only inhibit the cell wall synthesis is what need to be remembered. OCPs, how do they prevent the pregnancy? Question number 78. Who will give me the correct answer among our online classmates? So, Tirupati is proposing they will bring down the LHFSH, right? Because they contain steroids. Oh, Manu thought it as they impair sperm penetration. No, no, doctor. Maybe he is thinking of progesterone only pills. They make cervical mucus hostile and makes for the sperm very difficult to get onto the top of the floor. So 78, without doubt it is B is the correct answer as told by Guntur.